Hello, my name is Jay Over and I'm one of the resuscitation officers at the Royal Cornwall Hospitals NHS Trust. Now the aim of this DVD is to show you an adult in-hospital cardiac arrest scenario. I've been a resuscitation officer for about 12 years now, and from experience I know that healthcare staff have the same concerns that lay people have. They're worried, they find it very stressful, they're concerned that they might do something wrong or they might harm the patient, or in fact might not know what to do if a situation arises. The Resuscitation Council UK are very aware of staff concerns. So they look at the evidence surrounding resuscitation and then try and interpret that to try and make guidelines as clear and as simple as possible. Because at the end of the day, we're all human, so we need every help that we can get when we're dealing with an emergency. We know that survival from an in-hospital cardiac arrest is very poor. About 30 to 40% of patients will initially survive a resuscitation attempt, but only 20% of those will actually go home with a reasonable quality of life. So it's vitally important that we recognise patients that deteriorate. This is the chain of survival, and these are the interventions that contribute to a successful outcome following a cardiac arrest. The first part of the intervention is recognition of a sick patient. If a patient is deteriorating, then we need to act quickly to escalate help and intervene with the appropriate treatment. Approximately 80% of patients will show signs of deterioration prior to an arrest. If a patient arrests, early CPR after calling from the crash team is essential. Evidence shows that people who receive poor quality CPR with interruptions do not do well. Therefore, it's really important that we do the correct rate, depth, ratio with minimal interruptions. Chest compressions increase the coronary perfusion pressures, and every time we pause compressions, the pressure drops. The third part of the chain of survival is defibrillation. Not all patients are going to need defibrillation, but if it is required, it's essential that that's done quite promptly. Now, some nurses will do extended life support training and will be able to operate a defibrillator or use it in automated mode. And the final part of the chain of survival is the post-resus care. Post-resus care marks an important continuum of resuscitation. So this might mean stabilising the patient, getting the right transfer equipment and transferring them to a point of care like ITU, HDU, coronary care or cath lab. Essentially, the approach to in-hospital life support follows 3 steps. Confirm arrest using a doctor's ABC approach, make sure help's on the way and start CPR. We're now going to see the real-time demonstration of an adult in-hospital cardiac arrest. It runs from the point where the ward staff nurse finds the patient in collapse to the point where we put the defibrillation pads on and we're ready for the cardiac arrest team to arrive. We're going to run the demonstration in real time initially, and that way you can see the process as it would happen in real life.
Mr. Madden, hello, can you hear me? Gemma, can I have some help, please? Gemma, help! What's the second one? I think he's arrested. 3, 4, 5, 6, 7, 8, 9, 10. Cardiac arrest.
I'll call the double two and get the crash trolley.
Shall I you take over, please? 1, 2.
And 1 and 2 and 3 and 4 and 5 and 6, 7 and 8. You're now going to see the demonstration again, but this time we're going to slow it down and break it down so you can see the individual processes and steps involved. Initially, you should ensure that it is safe to approach the patient. You must then shake the patient by the shoulder and ask them something like, "Are you all right?" Once confirmed that the patient is unwell and not responsive, you need to shout for assistance and/or pull the emergency bell. You should open the patient's airway using a head tilt chin lift technique. Place the heel of your hand on the patient's forehead and with the fingers of your other hand under the chin, gently tilt the patient's head back. If you suspect a cervical injury, healthcare professionals only would open the airway using a jaw thrust technique. With the airway open, you need to assess the patient for signs of life. Look for signs of normal breathing and other patient movements. Listen and feel for expired air. Take no more than 10 seconds to do so. If confident, healthcare professionals would also feel for a carotid pulse at the same time. Now you have confirmed arrest, you need your assistant to go and call the crash team. If you were still on your own at this point, you would leave the patient and go and call for help yourself.
Hello? Cardiac arrest, Ward 10, second floor tower block. Yeah, okay.
Once help is on the way, make sure the patient is on a firm surface and in a flat position and start compressing. Place the heel of your hand in the centre of the chest or the lower half of the sternum. Grasp your fingers so pressure exerted only down through the sternum. Press down 5 to 6 centimetres in depth at a rate of between 100 and 120 compressions per minute. The ratio of compressions to breaths or ventilations is 30 to 2, but remember in hospital, usually a ventilation device such as pocket mask or bag valve mask is readily available, so there will be no need to perform mouth to mouth. Whilst waiting, it might be necessary to compress more than 30 times. Just keep going until your assistant is ready with the bag valve mask or pocket mask. There is a likely chance that you might fracture the patient's ribs or sternum, and whilst this feels quite scary and uncomfortable, you must continue at the same rate and same depth. Unless you are confident to do so, when asked to manage the airway, you should use a 2-person bag valve mask technique. Attach the bag valve mask to oxygen and turn on. Ensure you have the right size mask. Place the mask over the patient's face, ensuring that the nose is adequately covered and the bottom of the mask sits in the dip of the patient's chin. Hold the masks to the patient's face using either a thumb or forefinger technique. Remember to open the airway, and the nurse who's just been compressing will gently squeeze the bag with just enough force to ensure that the patient's chest rises. If there is a third person available, they can apply the defibrillator pads that will be used to look at the cardiac rhythm and deliver a shock if required. Most pads will have pictures on them that will indicate where they need to be placed. The sternum pad goes below the right clavicle to the right of the sternal border. Remember, some patients might need to have their chest hair rapidly removed if it might interfere with pad adhesion. The apex pad needs to be placed in the mid-axillary line. Once the pads have been applied, some staff who have received extended training will continue and operate the defibrillator either in manual or automated mode. If you are unable to do this, you are now waiting for the cardiac arrest team to arrive, so remember to swap staff compressing as they get tired. Try to do this when ventilations are being delivered to minimise the interruptions to compressions. We hope that's been beneficial to you in that we've broken it down into the small component parts to make it simple. Remember, confirm arrest using your doctor's ABC approach. Make sure help's on the way. Start compressing and above all, stay calm. Choking is characterised by a sudden onset of respiratory distress, usually associated with coughing, gagging or stridor-like noises. More often than not, it's witnessed, But if not witnessed, obviously the patient will collapse. And here, the rescuer will follow a simple, basic life support technique. It's essential that you quickly assess the situation. Make sure that it's safe to approach the patient and then look at the state of their coughing. If it's effective, then just leave them. Monitor the situation and look for signs of deterioration. If their cough is ineffective but they're conscious, then you're going to follow a set of back blows and abdominal thrusts. If their cough is ineffective and they're unconscious, here you will follow your simple CPR techniques without assessing ABC. So basically, just start CPR. We're now going to see a demonstration of a staff member being faced with an adult patient choking. They have an ineffective cough, but they are still conscious. The nurse has made a rapid assessment of the situation and knows that she has an adult with an ineffective cough, but who is conscious. So the first step here is to deliver up to 5 back blows. Ideally, this should be done with the person being supported in a forward-leaning position. If the 5 back blows are not successful in relieving the obstruction, then you need to move on to the next step, which is the delivery of up to 5 abdominal thrusts. If the adult becomes unconscious, you do not need to assess ABC. Just start performing CPR by delivering 30 compressions to 2 ventilations or breaths. In hospital, it's usually very easy to get help. So if there's somebody available, send them immediately to call the emergency team. Only if you were alone would you stay with the victim, continue with the choking algorithm, trying your back slaps, your abdominal thrusts, until you either relieve the obstruction or they might go unconscious with you. Still, you would stay and do up to a minute's worth of CPR, and then you would need to get help.